January 1st, 2020 marks the day Medicare now pays for beneficiaries' opioid use disorder treatment. Today's tip is not at all inclusive and not intended to be comprehensive. Please utilize the URL references contained in this educational video for more information. The Opioid Disorder Treatment Program, which I will refer to as OTP for the remainder of this video, however, must be Medicare enrolled in order for Medicare to pay for the services. We have a separate YouTube video all about that, and if you're looking for further enrollment details, I advise you to check it out. After enrollment, your Medicare Administrative Contractor, MAC, will verify your SAMHSA certification on the SAMHSA OTP directory. It's your office's job to verify eligibility of the Medicare beneficiary and to code claims appropriately. So use these new special G codes created by Medicare, which is the focus of this video. Any beneficiary with a diagnosis of opioid use disorder is eligible for these services. This is billed under Medicare Part B. There are a whopping 14 HCPCS G codes created for OTP services. These codes are assigned a flat dollar amount. These codes go from G2067 to G2080. So here's some codes that Medicare has established. Methadone is billed as G2067, whereas buprenorphine, oral, injectable, implants, start from G2068 to G2072. Code G2075 is used when you give medication-assisted treatment, MAT, services with a new opioid agonist or antagonist treatment medication approved by the FDA under Section 505 of the United States Federal Food, Drug, and Cosmetic Act. NonDrug Bundle is coded as G2074. Let's talk more about the NonDrug Bundle on the next slide. Okay, so for code G2074, CMS gives us an example. A patient receives an injectable buprenorphine on, let's say, week number 1. And so Medicare would then expect you to bill using code G2069 for that week number 1. But now let's say for week number 2 and week number 3, this patient doesn't receive any medication. For these 2 weeks, the patient only receives non-drug services. Medicare would then expect you to bill code G2074. The patient then, on week number 4, receives another injectable, buprenorphine. You would again, like the first week, bill using code G2069. For details regarding billing and payment for OTPs, go to your MAC website or use this URL for the national cms.gov website. An easy way to locate this information is to go to www.cms.gov and enter the phrase opioid treatment programs in the search field.